Hey everyone, welcome to the last video in this section of an overview of climate smart healthcare. This video here is going to focus on interprofessional solutions to promote climate smart healthcare. The learning objectives for this section are going to be to explain the concepts of multi-solving and co-benefits that are associated with promoting sustainability and resilience and addressing the health impacts of climate change, and identifying opportunities for interprofessional collaboration to promote these sustainable and resilient healthcare systems. So if you'll recall this earlier diagram here from the World Health Organization, and you'll remember that these processes for developing these climate resilient and environmentally sustainable facilities or systems, this applies across the board, first of all requires us to develop awareness and political commitment, but then it secondarily requires us to assemble and train this multi-sectoral operative team. So from the very get-go, we need interprofessional collaboration in order to effectively start this intervention process to ultimately develop better systems for us to address climate change. This diagram again from my earlier segment, just talking about leadership governance within our healthcare workforce, designing our infrastructure, designing our service delivery, health information technology, all of these things. Again, if you think about who will need to be involved in order to take these building blocks of our health systems and promote climate resilience, that's going to involve a lot of different professions to form that team. So I wanted to highlight this concept of multi-solving. So multi-solving is a term that refers to collaborations to deliver improvements in multiple sectors with the same investment of time, money, and political will. So there are certain steps that we can take to promote climate solutions that might also promote better access to clean food and water, better jobs, better security and assets, better overall connection within a community, so community benefits. But in order to accomplish this, we're going to have to overcome disciplinary silos, budgetary silos, jurisdictional silos. We need to engage communities. We need to be proactive in the way that we fund. We typically are not great at funding prevention. We're typically very reactive as a healthcare system, so we need to kind of shift that paradigm. And we need to be systems oriented rather than being just short-term decision making. We need to think in the long term and look out ahead. And so being kind of forward thinking, proactive, and looking at what sort of benefits, how can we maximize the good in our actions across multiple sectors. These are different examples from the CDC guide for cross-sector collaboration in efforts to promote climate preparedness. And you can see in this list here different professionals that will need to be involved in healthcare adaptation or disaster management. And these are kind of the usual suspects potentially in communication officials, people within nursing homes and home care programs, teaching hospitals, academic medical centers, emergency medical services, and grant writers and resource development within hospitals and clinics. These, as we talk about interprofessional teams, sometimes you're just thinking about the people that you go round with in the ICU in the morning, or that nurse you work with down the hallway, or the doctor in the room with you as you're talking to a patient. But really kind of expanding those definitions and cross-sector collaboration is going to be important. Again, in disaster management, how do we interact with public offices, the National Guard or other uniformed services, first responders, facility managers, even out in community institutions, school districts and hospitals, professional associations. All of these people are going to need to be involved in order to really be effective in collaborating and addressing or preparing for the impacts of climate change. I also wanted to bring back this earlier diagram here showing the healthcare facility capacity, recovery, and resilience level, just to emphasize the fact that our resilience to acute and chronic climate-driven stressors are going to depend on a number of different factors that are really going to require a team approach in order to effectively address the exposure and vulnerabilities and our recovery capacity and our ability to learn and improve as a result of our changing dynamics and potential stressors and impacts and everything else. So teams are kind of the key to developing these adaptive and resilient systems. These various components of hazard, vulnerability, and exposure that make up kind of our overall calculation of risk can all be addressed individually and should be addressed as a part of a holistic plan. And so if you look at examples that maybe address our ecosystem-based measures and our different forest and wildlife management, transportation, measures to improve air quality, to reduce hazards, that's definitely going to have to look outside of the healthcare sector in order to really effectively address those. If we look at vulnerability, different social protections, livelihood diversification, so people don't lose everything if there's a natural disaster that comes and wipes something out, insurance solutions, healthcare access, some of that can come from within, but certainly we're going to have to, as healthcare professionals, look outside of our professions and kind of maybe engage in some non-traditional alliances in order to effectively address this. Other ideas of, potentially promoting early warning and evacuations, land use planning, exposure controls, again, it's going to take a broad and diverse team in order to effectively address these things. When we're thinking about health care as a whole, we really need to expand that definition and think more about the determinants of health and the other factors at play when we are looking at our resilient systems. So ultimately, when we're thinking interprofessional, let's expand that definition. Let's think about meteorology, energy and utilities, land management, transportation, city planning, agriculture, those experts in sustainability, educators at all levels, whether it's in elementary, K-12, higher education, and community leadership. All of these people need to be involved, and this needs to be our interprofessional team if we're going to be truly successful. To continue the Venn diagram theme here, the other thing that I want you to think about is your role on an interprofessional team. And so you might be a nurse or a pharmacist or a physician or maybe a public health coordinator. Whoever you are, it's not only going to be a matter of what your profession is, but also what are your skills, what's your passion, and what is needed in order to address these issues. And where all of those things intersect is really where I think you can find the sweet spot in your role. So I think that this is a good exercise to think about and say, okay, where do I fit? What are my skills? What can I contribute to this? How does that meet the needs? And what is it that really, drives me, makes me tick, and allows me to contribute to my fullest ability within this team? There are different models that also promote interdisciplinary work, and one that I mentioned earlier but bring back is One Health model. So One Health is similar to planetary health, which I highlighted before, but slightly different and a little bit more focused on animal health in the context of environmental health and human health. And their specific model outlines incorporation of collaboration across a wide variety of disciplines and across large regions and multiple levels, including veterinary medicine, wildlife management, scientific researchers, environmental health, and the medical community, and thinking about how we coordinate, collaborate, and communicate better to get ahead of emerging zoonotic disease, vector-borne illness, thinking about how we're going to engage in effective research in order to develop effective solutions, and ultimately how do we kind of recognize that we're all on the same team to protect the health of the environment, of animals, and of humans as we coexist here. I'd like to wrap up this section by highlighting a case study of an organization that I've had the opportunity to work with that I think does a nice job of kind of reinforcing the concepts of multi-solving, of what creative interprofessional collaboration could look like, and the ideas of how climate solutions can ultimately become healthcare solutions and vice versa. So how does the environment impact human health, but also how does human health change the way that we interact with the environment? So this is a story of Gunung Palung National Park in Borneo. Gunung Palung is an incredibly resource-rich, carbon-dense, ecologically diverse rainforest. It's a critical habitat for orangutan, and this story is going to start out with the issue that there was massive deforestation in this area and a great concern for habitat loss, for loss of biodiversity in the area. And this was occurring as a result of both illegal logging practices as well as a result of slash and burn farming practices. So researchers went into a nearby community in Sukadana, Indonesia, and they started asking some questions. They wanted to explore this from an environmental and wildlife management perspective, and they wanted to get to the bottom of this issue, figure out what was going on, and rather than, initially jumping to conclusions and taking a punitive approach to illegal logging, figuring out if they could address some of the root causes within the community. The map at the top of this slide here shows two different things. First, in pink, it shows regions that have low healthcare access. And in green, it shows regions that have high forest carbon density. And then in the striped areas, it shows where those two parameters overlap. So both low access to healthcare and high carbon density. In the yellow circle there, that highlights the region in Borneo that I was talking about. So you can see here the deforestation trends over the last several decades, where the total land cover in terrestrial national parks that was previously forest was lost 20% of its ground cover. So a significant deforestation, which is a real issue. If you just look specifically at Gunung Palung National Forest and the amount of carbon that it sequesters, it's equivalent to approximately 14 years of San Francisco's carbon emissions. So just to try to put that in context, if that area was deforested, that's how much carbon equivalence that would be. So a huge issue. And why am I showing you these two different things? So deforestation and low access to healthcare. These seem like they're maybe not even closely related at all. However, the researchers that went into this community found that there actually was a relationship. So people, when they needed healthcare in the area, it was often expensive. They didn't have good access to high quality care. They potentially had to travel long distances, pay up front, pay to stay in a new region. They had lots of upfront costs. And so in the case of acute illness, a family emergency, or somebody who was struggling with chronic illness where they needed repeated visits, it was very, very expensive to receive care. And one of the most readily available sources of income was to go into the forest, cut down a tree to sell. And they might not like to do it. It was dangerous, both due to injury, falling trees, cutting themselves with chainsaws, and also due to the legal consequences if they were caught. But if a family member was sick and needed care, it was a necessary choice. So healthcare issues were actually driving these environmental issues. Conversely, these environmental issues were also impacting human health. So standing water left behind by deforestation and slash and burn farming practices increased mosquito habitat and transmission of mosquito-borne illness. And the water quality was impacted by increased water runoff during rainy seasons without the forest there to buffer and soak up some of that rain. People were exposed to hotter temperatures because the forest acts as this incredible insulator that absorbs heat and cools the forest floor and the areas around it. And sources of medicinal plants were being disrupted, food yields were gradually decreasing as slash and burn farming became less and less sustainable. So, overall, there was this strong interaction between the environmental conditions and the human health conditions, and each affected the other. So, the low access to healthcare was perpetuating that illegal logging, the illegal logging was perpetuating health issues, and so on. So, by engaging the community, rather than taking this punitive approach, making assumptions about what was going on, they were able to learn something new, figure out potential solutions, and move from there to work as a team to try to figure out what they could potentially do to address these issues in a creative way. Specifically, they established a clinic, Alam Sehat Lestari Clinic, or ASRI for short, in Sukadana, Indonesia, which is a kind of central community right next to Gunung Palung National Forest. It has about 100,000 people within its catchment area, and they established this clinic to provide quality health care and simultaneously provide incentives for environmental protection. So the clinic established care under an alternative payment model, so it allowed people to pay for healthcare by either trading in, potentially whatever goods or wares they normally traded in, just trading directly, but also allowing people to pay for healthcare by spending time growing seedlings or helping with reforestation projects, so taking very systematic approach to reforesting those heavily deforested areas. They also offered cheaper healthcare for communities that did not have illegal logging, so kind of put social pressures and financial incentives to prevent illegal logging in certain areas. This clinic also took a very community-based and holistic approach, so they not only provided healthcare, but they also realized that there was a need to provide alternative livelihoods. They used a chainsaw buyback program, so had forest managers go out, work with illegal loggers to pay them money, give them a microloan, take the chainsaws, and give them an alternative livelihood so that they didn't feel like they were backed into such a corner that they had to go into the forest to log. They also promoted organic farming. They had a program you can see on the right-hand side of this photo here called Goats for Widows, that widows were often left to be very kind of economically in a bad position if they lost their husband. The husband was typically the primary breadwinner, and goats were actually a very financially viable source of income for these women. And so they went out into the community, provided them goats, and they were able to use the goats to both generate income and generate their own food, use manure for organic farming, etc. So they, took this financial approach, this community development approach. They also did a lot of community outreach, education, and engagement to demonstrate the importance of the forest and human health and for the community. And so this took not only doctors and nurses and forest management and educators and people who specialized in ecological diversity of the rainforest and people who were managing orangutan populations, etc. It took this very holistic approach that engaged the community, that thought about, potential disparities, inequities, really worked together to listen to solutions, and, took this ultimately very creative approach. And they've been very, very successful. Looking at the environmental impact of this organization, they've regenerated over 52,000 acres of rainforest. They've planted over 200,000 seedlings. They've seen a 90% decline in illegal logging in the area that they serve. They've protected habitat for over 3,000 orangutans, and they've established 17 active farmers cooperatives. So this is Osprey Clinic in partnership with a US-based organization, Health in Harmony. And down at the bottom corner of the slide, you can find a little bit more specifically on their results, their annual reports and everything, and kind of track the progress of this organization. On the healthcare side of things, this clinic was able to see over 95,000 patient visits since it was established in 2007 and has provided healthcare access for the Sukadana region, which is over 120,000 people. They've seen a 67% decline in infant mortality, they've seen 54% decline in births per mother, partially due to contraceptive, reproductive planning, and ultimately has improved overall maternal and pediatric health. They've also seen significant decline in malaria, TB, other childhood disease, and they've had an impact overall on the ability and access to care for COPD, diabetes, other chronic conditions, as well as acute trauma, and have seen significant impact in the outcomes there. And you can see across the board the benefits in the number of people who are employed at the bottom left here, the amount of logging, the people who are fishing, the people who are farming, etc., looking at those alternative livelihoods and the perceptions of neighborhood wealth and household monthly income. All of those economic outcomes were very positive as well. So just taking this holistic approach, thinking across disciplines, thinking across how can we address multiple things in one initiative or through kind of one keystone project, you can see that this is kind of the encapsulation of the idea of interprofessional collaboration, multi-solving, looking at the nexus between environmental health and human health, and thinking about how you can potentially solve two problems at once by addressing all of these things and taking a creative approach. So really, we need to think about this going forward, all these opportunities for collaboration, whether it's interdisciplinary courses for students, health professions, and others. So my opportunity to take an interprofessional team of students to go experience the work with that planetary health organization with OSRI in Borneo, or whether it's just an interprofessional course, whether it's an interprofessional student group. All of these things can really have an impact on our future workforce. Interprofessional or interdisciplinary government teams are going to be really, really important. Interdisciplinary community groups, advocacy organizations, looking at research grants where you're bringing together collective expertise and looking at a problem from multiple different lenses. All of these things are really going to be essential to develop the most effective solutions. So I encourage you all to kind of expand your definitions, expand your horizons, read more, look at what you can do to collaborate across sectors and potentially, find new solutions. I'll leave you here with some various links and tools for teamwork that I can recommend to check out. So Climate Interactive is the website that has the kind of highlighting the multi-solving, and they have different case studies as examples, starting points. They also have some framework that you can look through. The Planetary Health Alliance, in part of which is OSRI and Health and Harmony, they're part of this alliance, but also it's a worldwide network of various organizations working on planetary health, and they have various case studies that also highlight the opportunities for working collaboratively across disciplines. Within your own team and outside of it, there's the Team Steps system, which is designed for healthcare professionals, was originally designed as a kind of a team collaboration, patient safety tool, but it's also a really, really effective framework to think about overall collaboration, not just in crisis and community emergency situations, but also as this ongoing system for collaborative team care. Also, you should be thinking about community-based participatory research or asset-based community development. So, for instance, in the case of OSRI, or as Nikki Graham highlighted in her presentation, going into the community, finding their strengths, really listening to them, developing a relationship, partnering with them truly, and understanding their needs. And then the final resource that I'll recommend is the Asper Tracy Gateway. It's a healthcare emergency preparedness gateway that has a lot of really nice resources that look kind of in a disaster preparedness lens at interdisciplinary disaster response. But again, a lot of these principles can apply across the board that you can use, both not just in emergency situations, but also as kind of an overall approach or framework for thinking about these things. So thank you so much. I hope that this was helpful, gave you some new ideas or creative, at least gave an example of creative approaches that you might take when you're trying to address climate solutions within a healthcare system. And we'll see you in the next section.